My name is DeLisa Fairweather. I'm a Ph.D. researcher at Mayo Clinic in Jacksonville, Florida, in the Department of Cardiovascular Diseases. I'm a Ph.D. researcher that studies sex differences in inflammation, and I have just recently given a presentation at the International Academy of Cardiology annual scientific meeting held in Vancouver, British Columbia. My presentation was sex differences in biomarkers of heart failure. And what we have recently found is that sex differences are fundamentally important in all cardiovascular diseases and all inflammatory diseases. So what people may not realize is that sex hormones are not just important after puberty, but actually from the time of when you're in your mother's womb. The sex hormones are influencing your biology and your physiology and affecting the responses that you will have to infections and leading to disease. And so our laboratory has been studying how sex hormones affect inflammatory chronic diseases like autoimmune diseases and cardiovascular disease. And we've been looking at biomarkers that predict heart failure. And what we have found studying these biomarkers in the sera is that sex differences occur in these biomarkers. And so, for example, some biomarkers may be carried by one sex. So that means you see an association between heart failure and death in a sera biomarker like soluble ST2, and that increase really can be found only in one sex because of how sex hormones are influencing the presence of that biomarker. And in other situations, you find that that sex differences mean the biomarker goes in different directions for each sex. So for males, you might have an increase in that biomarker, and females, a decrease that relates to heart failure. And so it's very important to understand these sex differences that have to do with age. And so what we have found with soluble ST2 and a disease called myocarditis, which is inflammation of the heart, is that it increases predominantly in males, and we see this both in patients and in an animal model of myocarditis. And that increase is not seen in females. And when we look at markers of heart failure like percent ejection fraction and also New York Heart Association class, we see that those increases are really carried by males and not by females. And so it's very important to understand this difference when you're going to use ST2 as a diagnostic marker or to inform you for clinical care for the patient. And so we found in the animal model that ST2 is actually protecting against heart failure in the animal model. And so what we're doing now is increasing the number of patients that we can look at and seeing if this is something that is associated just with myocarditis, leading to dilated cardiomyopathy and heart failure, or if this sex difference is also true for other cardiovascular diseases like atherosclerosis. And so that's what we're currently examining. And the take-home message is really that if you're looking at biomarkers in the sera for heart failure, you need to understand if there's a sex difference exists, and that also there could be an age difference in women pre and post menopause, and that you want to examine that to see what's happening with your biomarker.